what Joanne talked about, over 300,000 people coming through the FQHCs last year. Okay, the Tennessee the Tennessee Hospital Association talked about over 300,000 people that would now be eligible that went through hospitals last year. All right, so how are we going to get to over 500,000 people? We're going to get to them this way. All right, believe me, y'all don't have to enroll all 500,000. I know you feel better now. Because they're going to get enrolled here. They'll get enrolled in workplaces. Employers that have less than 50 people are going to work with brokers. They'll work with brokers, God willing, and people will get enrolled in workplaces, okay? Hospitals, health places. Workplaces, health places. Hospitals, FQHCs, charity centers, doctors' offices, they'll show up there, okay? But what happens if only people who have issues get enrolled into the marketplace? It's going to throw the economic system big time. So what we're going to do is we're going to focus on life places, the ones that we talked about before, because this is where people are, okay? But we won't need to enroll. We get 3,000, Brad, what did he say, 3,000 people? That's new. That's a lot of folks. We're not going to do that every single day, but we do need to get coordinated about how we're going to get into life places. So our grant, so the federal grant was for $1.4 million. We wrote for $1.3 million. Now, knowing that money would go to Dranda's organization, right? But what the heck? What was the worst they were going to say? We won't give you all that money. Like, okay, just give it whatever you want. Because we're moving ahead anyway, right? I don't care if the feds say to me tomorrow, August 16th is my birthday, by the way, so August 15th is when we find out. We're in August now. That's really good. I love August for my birthday. But anyway, so if they said, we're going to give you $400,000, Lisa, Seedco's going to get $400,000, I'm going to say, that is great. That's great. Because we're going to do this anyway. We're going to do this anyway. All right? We're going to focus what we did with our grant application is focus on the high population urban areas and funded the Tennessee Healthcare Campaign to do the state. Okay? To be in the places, to be in areas where, that they will trust you more than anything else, and that no one else is. So the emphasis, as Tony mentioned earlier, connecting navigators to the community-based CACs, and we can talk about that in a sec. Natural points of entry for target populations. This is the most important thing, okay? Now think about your own neighborhoods. Your folks aren't going to trust a stranger coming to their house or seeing them in the market or whatever. They're going to trust you. They're going to trust you. That's really, really important. So that's sort of what it looks like, what we were thinking of, 18.5 navigators. And I live with this every night. 18.5 navigators is definitely not going to enroll 500,000 people. The math absolutely doesn't work. So here, this is what's really important, y'all, and this is what I want you to remember. So we're going to need to focus on our strengths, okay? Now, that second bullet, heartbreaking for me. Okay, the grant plan, like my diabolical plot, was to set up this statewide network, so when Medicaid, when it got passed, the plan got passed, we could just drop it in. I kind of don't think, even I don't think that's going to happen. So what it means now is that the way that we're going to get this is with clear communication, best practice sharing, continuous learning. All that stuff is going to go on. Regardless, it's going to be a seamless system. Okay, for the FQHCs, for the folks that are funded with us, for volunteers and communities doing this work, that's what it's going to look like. So every partner has to participate. Everybody has a vested interest in seeing this thing happen. So this is a brand new chart. It's never been road tested. Okay, thanks to Andrew at Baptist Healing Trust for putting this together. You have it in front of you. Okay? So y'all, I need you to tell me what you think about it. I'll walk you through it. And I think I have a couple minutes left. So From my perspective, the natural question for everybody in the room is, where do I fit in? How do I do this? Okay? Now, Beth talked about how if you want to be, now the navigators, just to be clear, the only people that are called navigators are the ones that are funded with federal money. And we've already established that federal money is this, okay? But they are key in terms of leadership in communities across the state. They will be key because they'll be good connector points with the FQHCs and with organizations across the state. But from my perspective, there are 3 different activities and ways for you to get involved. Okay? The first one is with outreach and education. That's you out there, your best friend, you're sitting with her over the table at lunch. This healthcare reform thing is nuts. And you can say, wait just a sec. I know how to this and this and this and this, and you'll make it clear for her. You can do this, okay? So you don't need to be certified to do that. You don't need to be certified to do that. You could speak at your church about what this is. You could speak at other community gatherings. You could speak at back to school night, right? You could speak at admissions day at your local tech school. Y'all could do that. Okay, anybody could do that. Pre-enrollment activities, okay? Now, what happens when you, and forgive me for not knowing what you all heard but to this point, but the marketplace itself is sort of a vetting tool, and then it's about the healthcare system tool. So the vetting tool is what I'm picturing there. The folks can get on and provide individuals with their options. You guys learned about the marketplace. Uh-oh, did I do that? I know I didn't do that. Okay. Did I turn it off by accident? Okay, I'm gonna use my big voice now. I did turn it off. Testing. Yay. We'll just sing a rousing "Take Me Out to the Ball Game" while we're at it. Okay, so the middle is just it's pre-enrollment, right? Y'all get that? And the last one is all about enrollment. The only people that can enroll people on the marketplace are certified application counselors and navigators, period. That is it. Okay, what in the heck? Okay, I'm gonna hold, you know. Okay. All right, I'm gonna hold, okay. So, I feel like I'm on candid camera.
I think we've got a low battery.
Okay, that's all right. Okay. All right. I'm so sorry, y'all. I'm going to go ahead and really use, I sang in choir a long time ago. I really am going to have to do that. And I apologize.
You're gonna do that, so
Okay. All right, so I'll come forward a little bit, okay? All right. So the last one's about enrollment. Y'all get that? So there's a range. That was the idea. Does this work? Is this understandable a little bit in terms of clarifying where you plug in? The idea is you can't be a certified application counselor unless you're associated with an organization that is certified to do that. My suggestion would be, the obvious one would be the Tennessee Healthcare Campaign. They are going to be certified as an organization. Makes perfect. The Tennessee Healthcare Campaign, the folks that are putting on this conference. I personally think that would be, for me, now there may be nonprofits in your area that you want to be associated with instead. If you're who in the room is an entity that wants to become certified or is interested in doing so? Okay, cool. So what we're going to do, just as a part of our leadership position, and I'm sure Baptist Healing Trust will do that also, is have a resource for you to climb on and see who's certified in Tennessee. So you can make decisions for yourself about who you want to certify with. Okay? All right, so this was the first, we'll take questions at the end. I'm sorry, y'all, I'm almost done, I promise. So you saw these messages with Tony? Yeah.
I don't know how long it might last, but we're getting a replacement just in case.
Hey, you guys speak really quietly, you don't learn. Okay. Oh, God. All right, so, I swear to God, this is a trick my kids would play on me. Okay, so here are the messages, right? So this is what you can do. The first thing that you can do right now is start using these messages. All right? What agencies can do right now, apply to be a certified application counselor, a certified entity, and start identifying staff and volunteers that can become certified. That's what you would do. And if you're an individual, an unaffiliated individual, then you can get involved as an outreach volunteer. Really just stay informed, learn it. You may not love to learn it. I mean, look, Beth has the new regs on her table. It won't look like that. I personally don't carry the regs around like that. However,
Pages of riveting reading.
it's riveting. But there will be other ways for you to get information and connect with the CAC entity. So what Beth and I have been doing is we've been doing a roadshow, which you can imagine is very exciting. And we've been doing this presentation across the state. And where's Howie? Howie's been also across the state, the Energizer Healthcare Bunny. So she's like, you know, a force of nature. And so really what's cool is people are starting to show up at those presentations. I was at one in Memphis that they did a month and a half ago. Howie was there, and Brad, and I think they maybe had 45 people in the room, maybe. And so, but the one that I attended at the United Way a couple weeks ago had over 100 people. So people are starting to get it. They're starting to get it, which is great. The other thing is that we're building a fundraising strategy. So I know that it's going to take money to do this. I know that there are some things that only money won't pay for, but we're, as I said before, we're going to move forward anyhow. So this is us. The last thing I want to do is thank you in advance, because I don't know when we're going to be in the room again together. To Tony's point about data and using data, a show of hands again, those of you that have been involved in the campaign, right? Okay. I ran for Metro Council in Nashville, and I lost. It was really the best thing that ever happened to me. Honestly, I wouldn't be standing here. It's funny, life is a funny thing. I wouldn't be in Memphis, and I wouldn't be standing here if I'd won. So that's a very cool thing. But I will say this, that the data that Tony can get to us as a state is the data you will use to structure your activities, and we will get that data to you. You will get the data, okay? So everybody will have a job to do, and we all have a really big job to do. I just want to thank you in advance, because it's a big job, and to start taking your vitamins now. Between October 1st and the end of March, oh yeah. It's probably going to be one of those most exciting, nerve-wracking, difficult, wonderful moments that we've been in for a really long time. And I look forward to partnering with everybody. We'll take questions now, I think. Thank you.
All right, we got 3 minutes for questions. All right, let's see. The woman in red. Yeah, let's.
Can you tell me more about this thing I'm hearing called the champions and what they have, what role they have?
Yeah, I can take this. So Champions for Healthcare is actually just a new entity that CMS and HHS came out with, and I think it was maybe just a week and a half ago. Vicki talked about this when we were on the panel in DC, and these are organizations, probably businesses, that can help disseminate information and education about the Affordable Care Act. So she used the example of like your local Starbucks can become a champion for healthcare by putting up posters about the marketplace and saying, guess what? Free or low-cost health insurance is going to be available October 1st. Check it out here at www.healthcare.gov. And so it's a way that organizations or businesses can sign up and actually receive those materials that they can disseminate.
Is that a role for universities?
Certainly. Let's see.
So where do you get those materials?
You have to sign up as a champion for healthcare, and I think following this up, can we send stuff out?
Yeah, well, I'll absolutely include a lot of that stuff. And to be a champion, if you want to sign up to be a champion of healthcare, there you go. You can actually email champion@cms champion.hhs.gov. Again, champion@cms.hhs.gov.
And another role for universities, by the way, another role for universities is with internships. This has internship written all over it, especially your fall interns.
Social work students looking
Well,
at you.
public health, social work, public health. No.
No.
What
Okay.
is the- do you want to repeat?
Oh, what was the question? Is there a limit to what type of organizations can be champions? No. And answer is no. Okay, one more question, and I'm afraid we're going to have to wrap up.
Yes, after all this gets rolled out on October 1st, what kind of effort do you think will be needed to keep this thing going with new people coming into the system? Is this going to be kind of a permanent campaign, or is it going to end after the first year?
It was, yes, so the question was, what happens after the open enrollment period ends? So after open enrollment, only the people that become eligible can apply. And that's it. So there will be an ongoing need for education until next, I believe it's October 15th through December 31st, right? That's next year's enrollment for 2015.
December 7th.
Thank you. So it is, it's very short term. Just to let you know, there are a couple things that that we need to look at, and I'm sure you all will talk about this later. One is once someone enrolls and actually pays their premium, if they don't pay their premium again, so they have to pay the rent, they've got things to do, that money is, tight, right? Because they're dealing with the lives that they're dealing with. They won't be able to re-enroll. There will be a grace period, which we're still learning about, but they won't be able to re-enroll in the open enrollment period if they don't pay at that point. So continuous healthcare is an issue that we're looking at, not just that moment of enrollment, but helping people understand through financial literacy and impact on their lives, personal budgeting perhaps, how they're going to be able to keep paying, which is very, very important. I'm sorry, Brad.
That's okay, thank you. Unfortunately, I'm afraid that's all that we have time for, but I will just add on to that. So she said only qualifying individuals can be eligible to enroll after open enrollment, and that qualifying events are things like getting married, getting a divorce, having a child, or gaining a child through a marriage perhaps or something, or losing a job. Like all those things are qualifying events that will allow you to shop for insurance on the marketplace outside of open enrollment. And again, open enrollment is from October 15 in 2014. It'll be October 15 through December 7. It'll match that of Medicare open enrollment. So that's how you keep track of that. So thank you to our panelists, Beth, Lisa, Brenda. And I'm sorry we don't have more time to give you with these fabulous